Hi everyone, and welcome to Revive. We're doing our live Cryoskin demo. We'll be doing a slimming treatment on our volunteer. We're going to treat her belly, which you can see right in front of me. A little bit about Cryoskin. We'll chat for a few minutes and let people who are joining late get online. So what Cryoskin is we've got a little machine here. And this wand is used to massage the treatment area. It's thermochemically cooled to -8, -10 degrees after a short heating period. So you get a nice warm massage for a couple of minutes, and then the probe cools way down really fast. And the next part of the treatment lasts about 15 minutes in each spot. So we'll be treating 2 spots on our volunteer, our anonymous volunteer. So the treatment itself is going to last about a half an hour. The cooling process causes the fat cells basically to die and release their fat. And then over a period of several days, typically about 2 weeks or so, the body's white blood cells come in and eat up that fat like the old-fashioned Pac-Man game. And the body will continue to excrete that fat over a period of about 3 to 5 weeks. So the recommendation is to have a series of 5 treatments spaced about 2 weeks apart, so over a period of 10 weeks, to get the best results. And the typical result is about a 30% loss of fat in an area. So that's not a lot of fat. We're not going to take someone from a size 12 to a size 2, but it's perfect for like little mommy tummies or a stubborn area of fat that's not responding to exercise and diet. The really nice thing about Cryoskin versus some of the other non-invasive fat treatments on the market is that because this is a wand, we can apply it to a variety of areas. We don't have to just stick it in one place and that's where you get treated. It can be tailored to individual body types and individual body areas. So we can treat areas like the belly, the upper arms, thighs, hips, love handles in the back, bra fat. You can even treat necks. The other thing that this thing does is, in addition to the slimming treatment, it can be programmed to do what's called a toning treatment, which helps to tighten skin. That tends to be more of a temporary effect. It'll last 2 weeks to a month, but it's a really nice treatment for something before a special event, for a facial, for example. It also can be used to help with cellulite to a degree. And again, cellulite's really hard to treat. If you've ever come in and chatted with me about cellulite treatment, I'll be straightforward with you. That's one of the hardest things that we have to treat. Cryoskin does make a difference, at least on a temporary basis. So again, if we ever get to travel again and you're going to the beach and you want to look your very best in your bikini, alternating treatments of toning and slimming are really great for the appearance of cellulite. So we'll have questions as you log on here. I see we've got more people coming on. You can type in your questions. We'll have Anastasia will be doing the treatment, and she and our model will be chatting about sort of different questions that typically come up. I'll be on the computer, and be warned, our computer in this room is really slow. So if I don't answer you right away, please be patient, but I'll be typing in answers to your questions in the comment section as well. So with that, I will pass this off to Anastasia, and then we'll get started, and we'll go from there.
Hi everyone. Okay, before I actually start with the treatment, I'm going to do a measurement. Typically, if you come in for a treatment, I'll do a measurement on you. I'll get like a weight, measurements, and pictures. Obviously, when, if you're getting your stomach done, you're laying down, it's going to look a little bit different than, when you're standing up. So I always like to get measurements. So I'll do a measurement here on our model. And I'm getting 36 3/4 inches on her. So I'm going to leave that there because we should actually see some results immediately after the treatment. So what it is, it starts with the warming process for a couple of minutes, and then it goes to the cooling process. I use a gel. It's kind of like an ultrasound gel, but it's kind of like a skin protectant too, because the temperatures get cold. And I do apply that onto the area before I get started. And it is cold, and I already told my model that. So right now it's the warming period, the warming time. It's 2 minutes, and the wand actually you can see is like a pinkish reddish color. And it's already pre-programmed for the body area that we want to treat. So, I put in the area that we're treating, and it automatically has the time set in there for that specific treatment area. So it's just a nice warm massage. And I'll even ask our model how it feels. Does it feel hot, too hot, or anything?
No, it's warm, comfortable.
It's just a nice warm massage, basically. So it's just, doing this for a couple of minutes to get that skin nice and warmed up, which is heating basically that adipose or fat that's right under the skin to get ready for the cold temperature. So you can usually, like, one treatment is basically like 2 sections. And so it doesn't cover like a huge area, because you want to be able to target just one specific area to get to that negative temperature and to reach it. So you can't spread it out too far, or you'll never reach that those negative temperatures that you need. So it's basically almost, like the area that I'm massaging right now is one treatment area, and then I'll move to the other side of her abdomen. And for a lot of women that come in, it's usually, after they had babies, the C-sections, we see a lot of that, or just, sometimes the hips or the thighs that don't respond. So now we're getting into the actual, if you heard that beep, it just tells me now we're getting into the cold treatment. So now you can see that the wand is blue. And so basically what I kind of do is I just take that fat adipose and just kind of pinch it into the wand, between the wand and my hand, and massage. And it's nothing that's like, I'm not digging too deep, I'm just getting it so the fat is kind of pinched between the two to give it a nice elevation there to treat it. And so I do this and kind of keep an eye on my temperatures. Our target temperature for this part of the body is -8 degrees. It doesn't mean that we always get to that temperature, but that's the goal. But as long as we can get it into the negatives, that's a good treatment. How's it feeling? I'm asking
Good.
the model how it's feeling.
It's not too cold.
So as it's starting to get the skin cold, it actually starts to get numb to where you don't really feel it once it gets to those really negative temperatures. Right now we're at 4.5 degrees. So it's just massage.
So Julia just asked a great question. What is the pricing? And I'll go over this again at the end of the video. I'm typing you a reply to Julia, but this computer is painfully slow. But it's the pricing for the slimming sessions are $325 for one session, or $1,500 for a package of 5. So that's basically for those of you who are math geeks, that's a savings of $125. This month, we're having a special. If you buy a package of 5 treatments this month, you're not going to have them all this month, but if you buy a package of 5 treatments during November, you're going to save $200. And at the end of this live stream, I'll announce a special deal for those of you who have joined us online.
How often do you have to have the treatments?
Okay, so my model here, volunteer, asked how often we do the treatments. It's recommended that you have the treatments, the slimming, which is what we're doing now, every 2 weeks. So no sooner than 14 days apart, just because the fat cells that we're basically destroying with the freezing, they're going to break down and go through the lymphatic system. So we don't want to overload your lymphatic system. So we wait 2 weeks. And so, we ask that you drink a lot of water, extra water, not like you have to be drinking water like constantly and overdoing it, but, just consume your the normal intake. They say 8 glasses, just probably, an extra few glasses of water. It's just going to help flush all of that fat through your lymphatic system and out. So I add more gel as I do this. And right now we're at a -3 degrees on her stomach. And how does it feel?
Kind of numb. Your body adjusts. You really don't feel too much of anything cool.
Is it painful at all?
No, not at all. Very comfortable.
Okay. So there's nothing painful with it. It's not like, anything is attached to her, which could be uncomfortable with some other types of treatments. Because I'm moving it around and massaging as well. The worst thing I think is just, it can get a little messy with the gel, but, I protect your clothes with, you can wear older clothes, or I use the towels to cover you up, whatever area you're having done.
How soon do you see results?
Okay, so she asked how often or how quick we see results. It really depends on you, the person that's having the treatment. Typically, you'll see some type of a result immediately after. So we'll do measurements again right after this treatment. But, it's going to take some time for that fat to break down as well. And you need to, before the treatment, the day that you come in for a treatment, you need to refrain from any kind of sugars or carbs for at least an hour or 2 before, probably like 2 hours before you come in, and then for approximately 4 hours after the treatment. Stay away from sugars and carbs. And they just say that because in consuming any of those would really almost stop the process, because your fat cells want to grab a hold of all of those sugars and carbs, and so it's kind of preventing it from, it's working against the treatment basically.
Any other restrictions?
Restrictions would be, you can exercise and stuff. The only thing that we ask that you don't work out or get into a sauna or heat your body up before the treatment, because obviously we're trying to cool, get your skin and the fat cells cold. So heating your body up is just going to make it harder for this treatment to work. But you can exercise after. That's fine. We just don't want you doing anything before you come in for a treatment that's going to raise your body temperature or your core temperature. Right now we're at -4 degrees on this treatment. And we have about 5 minutes left of this treatment. So it doesn't take too long. And it's not like you're uncomfortable for, 10, 11 minutes. I've actually had people fall asleep during these treatments. Because it's like a massage. A massage with weight loss or fat loss benefits. So this would be something nice. Anybody, if you're looking for gifts, maybe asking your husband or whatever for a Christmas gift, maybe getting one of these treatments or a package might be nice. Or giving it to somebody as a gift.
What areas do you tend to treat the most in?
The areas that I tend to treat the most would be the stomach, the abdomen, like upper abdomen or lower abdomen, or the whole stomach area. I do the flanks, or the love handles, as some people call them. I do a lot of that, and a lot of women come in too for their arms, their upper arms. They call it like the bat wing area that just doesn't respond to exercise or diet. So it's good for those areas as well. But you can have any area treated. I mean, I've had people ask me to do their knees because they get some of that that fat that's like around their knee area. So you can do that. Their neck. There's really no area that you really can't do. I mean, as long as there's fat there, adipose, for this to treat. But we would have you come in for a consult. We'd sit down and talk with you about what you want to achieve and figure out what's going to work best for you. So we've got a few minutes left here of this treatment, and we're kind of holding at -4 right now, which is good. It's a very good treatment temperature. And how are you doing?
Good. It's cold, but comfortable.
Okay. So she's not having any discomfort or anything with this. And I don't know if you can see or not, but the area it does get nice and pink because of the cold temperature and the massage. And it might stay pink, for the rest of the day, or for, at least a couple hours. You might even notice a little bit of, looks like it might even be a little, like some swelling. Just from those cold temperatures, sometimes your skin just responds like that. But that's all normal. We're at -4.5.
How long is the treatment?
Well, for the my volunteer here asked how long the treatments were, and it pretty much just depends on the area that we're treating. For a bigger area like the stomach, typically it's about, for the whole treatment itself, it's about 32 minutes total. But if I was to treat like the upper arms, it's not going to it's not going to be as long of a treatment. It might take, 25 minutes. Just because typically you don't have as much area to cover. So it's really just geared towards the area that we're treating.
And when we're talking about a treatment, Julia brought up a good question that Anastasia is concentrating really on just one side of our volunteers' lower abdomen. And the reason right now, and the reason for that is that you really want to get that temperature down. If you're trying to cover too large of an area all at once, the temperature will not go down to ideal levels. So the next you'll do a warming phase here in a couple of minutes, and then do the other side of the lower belly. But that's all considered, that's all done at one price. That's one of our treatments. The machine counts it as two. We just count it as one.
Okay, so the machine just beeped, so it told me that we were done with the treatment, and now we're getting into the we're actually going to do warming again. So it's 2 minutes of warming the area, and then it's the cool down, which is about 12 to 13 minutes, and then it's another 2 minutes of warming with the massage afterwards. And the temperature got down to a -5. It was a -5 degrees was what we got down to on her right side of her abdomen. And that's the side, obviously, that I was treating, just this right side. And then, then I'll go over to her left side and do the same exact thing that I did over here. But that's all considered one treatment. So it's basically one treatment here, one treatment here, but it's all one. Hopefully that didn't sound confusing. So how are you doing here?
Good.
Good. Does it feel good now it's warming up?
Mm-hmm.
And it's that rapid temperature change, that going from that nice warm massage down to the -5 and then back up again to the warm is what kills the fat cells. So it's really important to get that nice negative number when you're doing the treatment.
Mm-hmm.
And maybe a less confusing way to look at it is that for the lower belly you get 2 treatments, but that's one session, and each session is 325. So that maybe makes it a little more clear.
Okay, so this part of the treatment is done. So I'm just going to kind of clean her off, and then another part is I actually massage. So I'm going to just massage the area that I treated, just to kind of help break down all of those fat cells that we destroyed. Okay.
So more massaging, that's not a bad thing ever.
Massage is always good. Okay, so now I'm just going to move over to the left side of her abdomen here. And as the other side, it's that 2 minutes of warming. Get a piece of my hair in there or something. So it really doesn't take long. I mean, you could come on your lunch break if you're close to here, from work, and have it done, because you're not gonna see anything. You know what I mean? It's especially if you have it on your abdomen or a place that's covered up. You have no restrictions for afterwards. You can go right about to doing whatever. You could go right to the gym after this if you wanted to. you just don't do it before the treatment. So that's one of the nice things with this. It doesn't take long and there's no downtime at all.
Is it permanent once the fat cells are killed off?
Well, you know, basically when you destroy a fat cell, it's destroyed. You know, you still have some fat cells that are there, but once they're gone, they're gone. You don't grow new ones. You have the fat cells that that you're born with, basically, from the way I understand it.
Right. Basically, what I tell people when I see them for consults for this is the fat loss is permanent unless you go on a donut diet, and if you gain weight throughout your whole body, then you are going to gain weight in the treated area as well. And that's not actually a bad thing, because you don't want a big divot there if you get a little fluffy later on. But it's a permanent fat loss as long as you're maintaining your regular diet and exercise levels.
Yeah, so it's not a treatment where you come and have it done and then it makes it okay to go and eat poorly, because you're just going to, gain the weight back. And it really would defeat the purpose of having it done. So it's really just something, I know a lot of people that they've dieted, they exercise, they're actually at a good weight, but they just have little pockets of fat in certain areas that nothing helps. So this is an ideal treatment for those areas. And like Dr. McGarry said, it's not something that we would recommend for somebody that's got like a lot of weight to lose. That's something, there's other procedures for that, just because it's not going to like take care of everything. This is just kind of for targeted areas. So yeah, it works great for smaller areas that that just don't respond well to diet. Just getting gel everywhere.
In your hair too.
Yeah.
Mm-hmm.
And in my hair, yeah. Am I getting it in my hair? I've been doing
Yeah,
this
you
and
don't
just
want to wear
massaging
your
some
favorite
pinching.
outfit when you come for your Cryoskin.
Yeah, don't wear your favorite outfit. But, even if you have to change, we've got robes and shorts and stuff that you can put on. But just know that it does get messy.
But the gel that we use is water-based, so
Yes.
if it does get on your clothes, it will wash out.
It will. So just like on the other side of her, on her right side, I just try to get some fat like pinched in between. That way it's really giving it a good treatment to get that fat in between the wand and my hand, to get that temperature down.
So for those of you that just joined us, we've got a few extra people here again. So we're at Revive, and we're doing a Cryoskin slimming treatment. I'm Dr. McGarry. I'm kind of out of, you can see me over here in the corner here on the edges. But I'll just go over again a little bit of the science about this. The way this type of treatment works is that you initially warm the area that you're treating. That causes vasodilation or expansion of the blood vessels there, and the fat cells get all warm. And then you rapidly cool those areas, and it's that change in temperature, that warmth down to a rapid cooling to negative temperatures that actually kills the fat cells. And that sets up a process called apoptosis for those scientists out there. And basically that's just death of the fat cells. They die over the next 3 to 5 days and release their fat. And the body's lymphatics come, the white blood cells come in and eat up that fat and process it through the liver, and you excrete that out of your body. That's part of the reason that we can only have a treatment every other week, because you have to give the lymphatics time to clear out that dead fat, and you don't want to overload the liver with fat all at once. You want to give it a couple of weeks to process the fat you killed, and you can come back and do it again. We recommend a series of 5 treatments for the most effective response, and typically you can expect to see about a 20 to 30% loss of fat in that area. And again, I think I said it before, you're not going to go from a size 12 to a size 2, but you're going to look and feel more comfortable in your clothes. This is designed to target problem areas that are not responding to diet or exercise. And you've just got that one, you're behaving yourself, you're following your New Year's resolutions despite the fact that we're all stuck at home. And this one spot that's not responding, this is the treatment for that. No downtime. Your only restrictions is that we ask that you don't want to exercise or sit in the sauna or be overheated before you come for your treatment, because we're trying to cool this fat down. And if your body's internal temperature is already high, that's kind of fighting against the treatment. The other restriction is no carbohydrates for a couple of hours before and about 4 hours afterwards. Again, you don't want to fuel up those fat cells when we're trying to slow them down and kill them off. So otherwise, you can walk in here, have the treatment over about a half an hour, get dressed, and go about your life. There's no other restrictions or downtime. There's no compression garments or any other, nothing visible on your body that you've had a treatment done. Immediately afterwards, you can see typically a half to up to an inch of sort of contraction and a smaller measurement. We're going to measure our volunteer here again when we get done with her treatment. And a lot of that is because of the muscle retraction because of the cold temperature. But it's an effect that will last a couple of days. And then as the body clears out that fat, that reduction in girth becomes permanent. What else am I missing then?
Contraindications?
Sure. So not a lot. Most of them are common sense. People who have, for example, Raynaud's disease, who react severely to cold, you don't want to have this treatment. We don't do it in ladies who are pregnant. Probably not going to hurt anything, but why would you risk it? People with liver, kidney disease, we don't want to stress their system with this extra bolus of fat molecules in the bloodstream. Any sort of open wounds, obviously, or skin disease like lupus or eczema, psoriasis, anything that's active in that area that we're looking to treat. But otherwise, very few restrictions for this. Someone asked earlier, is it safe for tattoos? And our volunteer does have a tattoo. And yes, the answer to that is yes, it is safe for tattoos. Because it works beneath the skin. It's safe for tattooed skin as well as all skin types. So darker skin, lighter skin, works on everybody.
So I'll ask our volunteer here how she's feeling.
It's cold, but it's comfortable. It's not unbearable at all.
Okay. So right now we've got about 5 minutes left of this side, and we're down to almost a -3 degrees. Our target temperature is approximately -8. It won't let us go any lower than -8. Is pretty much the way it's set up. But anything that's in the negative is actually good. So as long as we get to negative temperatures, it's doing what it needs to be doing. So it's basically just a nice massage. I kind of pinch that adipose or fat between my hand, my fingers here, and the probe, the wand. And I just move it around to get a nice cold temperature.
How much are consults?
Consults are free. If you're not sure about it, you want to come in and talk about certain areas, you don't know if it's going to be good for a certain area or not, to see if the treatment would be good for you or not, just call. We'll do a free consult. Only takes about, 10 or 15 minutes to have a consult, and we can determine if it's going to work for you or not. Hopefully you can hear us okay, because the machine actually has a fan and it turns on and off and it gets a little loud, so. So for those that are just coming on, I already treated her right side and I'm now treating her left side. And treating both sides is basically that's one treatment. I did one side completely and I do the other side, and that's one treatment.
So we're down to just a couple of minutes of the cold treatment left on our volunteer. And I promised I'd talk a little bit about a special pricing for those of you who stuck with us through this treatment. So what we set up to do is for anybody who has watched this, I'm just watching Anastasia, I'm fascinated. Anybody who's watched this treatment, if you schedule a package of 5 cryoslimming treatments before Friday, so today is Wednesday, so you have until Friday. Anybody who schedules it before Friday will get a free treatment at the end of their 5 treatments. So you get 6 treatments for the price of 5. So that's going to save you almost $500. That's a pretty awesome deal, especially around the holidays. And as you can see, we are all masked. We are a medical office, so all of our procedures are done keeping clean techniques in mind. All the rooms are thoroughly disinfected and cleaned between clients. Nobody waits in the waiting room. We're very careful about keeping you and our staff healthy, so no worries there.
So we're almost done with this cold treatment, and then I'll do another 2 minutes of warming the skin. And then I'll do a little massage, and then I'll take measurements again. But typically if you come in and you get a package, I'll do measurements and pictures and a weight on your first initial, the first visit. And then like halfway through your package, I'll do it again to see, where we are. And then, at the end. Okay, so we just finished the cold part. And we got down to about a -4 degrees on this side, which is good. It's actually really good. And how are you feeling?
Good. It's cold. The warming feels good, but it was definitely comfortable.
Good.
No pain.
So my volunteer here, she had no complaints at all. She said it wasn't painful, it was cold, but it actually gets so cold that it's pretty much numb. But then the warming that I'm doing now, you know, actually feels really nice. So we do this for 2 minutes. We're about halfway done with this part.
And we'll be posting before and after pictures periodically of our volunteer. She's given us her permission. The before pictures will go up either tonight or tomorrow, and then we'll post them again at a month, at 2 months, and 3 months. So she'll get her treatments then over a period of 10 weeks, and then you'll see the final results typically at 12 weeks. So that'll give you a really good idea about what most people expect from this, should expect from this treatment.
Just, you know, for any of those that aren't familiar with our hours, we are here until 7 o'clock. Every evening, other than Sunday, we're not open on Sunday. Saturday we're here from 9 till 3. So you know, these are different days that you can do treatments. Okay, I'm finished with this. I'm just gonna clean her off. So you know, we have hours, you know, in the evening too, to work around your work schedule, and on Saturdays. Not every Saturday, but we definitely can accommodate. So I'm just cleaning all of that gel off of her here, and then I do a little massage again. I'm sure I probably missed some of that gel, but that's okay. So I just do a little massage in the area that I treat. And it's nice and pink. Any pain at all?
No, no pain.
No pain. Okay.
Now sometimes after these treatments, about 24 hours later, so you may feel like you've done a few too many sit-ups, which is a good thing. That means we got really deep into the treatment, but it's not at all uncomfortable. It's just sort of gratifying, actually.
Sorry. Okay, so I'm doing measurements again. When we first started, it was 36 3/4, and now I'm at 36 1/4. So right there, you know, there's already a 1/2 of an inch. Yeah, right?
Mm-hmm, yeah.
Yeah, 1/2 of an inch just from doing that 30-minute treatment. But, you know, it's going to take time for that fat to break down and get, you know, to go through the lymphatic system. Every 2 weeks we do the treatment, is what's recommended for the slimming. If you opt for that toning session, which is just, it's not the slimming part, you could have that done, you know, every couple of days or once a week, because there's not as much involved. It's just kind of a toning. But we can talk to you about that if it's something you're interested in, or you can interchange them. You could do the toning and the slimming with the packages. So we're actually done. How did you feel the treatment went?
It was very comfortable. Felt like a massage. It doesn't feel too cold, so I would definitely do it again.
Okay, thank you. Any?
No, so again, thank you everyone for joining us. And again, the package, each session for pricing is typically $325. You can get a package of 5 sessions, so 1 treatment, for $1,500, which is a savings of $125 altogether. This month we are running a special, so it's $200 off the package of 5. Or if for all of you special people who watch the video, you have until Friday to book a package of 5 treatments, and you'll get a 6th one free. So certainly if you have any questions, you're welcome to call us, but we encourage you to come in for a free consultation that doesn't cost you anything but about 15 minutes of your time.
Okay.
So with that, we will say good night and thank you for joining us. And
Thanks,
keep an
everyone.
eye out for our next virtual open house. We're kind of having a good time doing these. This video obviously will be on Facebook, so you'll be able to find it if you want to tell your friends about it. And we will post it to our new YouTube channel as well. And there'll be instructions there on how to find it.
Yeah. Okay.
Good night, everyone.
Good night. I get it right here.